I want you to think about how are you testing glute max activation in general with our patients with neurological deficits, because commonly a lot of them can't get prone and they don't have the range, you can't get all these other pieces. I just want eyes on glutes because they are so important. That's what I'm looking for. Hello everyone. So I wanted to take some time to talk about the supine hip extension test, since that is one of my favorites. Now, not that I even do it officially. So I included the link to the article in the notes section so that you can look at it. It's an older article, but my main goal here is to really try to have a good handle on the activation of the glutes and where my patient's at with that. Not to mention in a position that makes sense. So when you go into loading response in the gait phase, that's when you're going to have your glutes kicking on the hardest. So I would like to know, how do they do with activation? Here's a great video of, so this gentleman's right side, he does have some involvement. So just to prep you, he does have some involvement with his right from a peripheral problem. He has an AFO on his right foot. His stroke was on the left side. So what I want you to keep your eye on, keep your eye on is his glutes. I want you to watch the first time I do this test, because if you haven't done it before, it's awkward. And again, I keep saying test, even though a lot of times I'm not using the scoring system, but you absolutely could. So that'll be noted in the note section. But I want you to, I'm looking for activation. I'm looking at how quickly do they recruit? Are they able to sustain that muscle unit activation while they're doing this? So when you see here so I lift up, and I'll talk through that way to do it in a second, but I just want you to look at his glutes, how they delay and then turn on, and then he tries, and then he tries, and then he tries. I want to compare that to the second time I do it. So generally I'm doing the stronger side first so they get a feel. I lift up the leg. I ask him to squeeze his glutes together as hard as he can. I'm then saying, don't let me lift you, as I pull up on his ankle. And then what should happen is right there. Let's see if I can pause it quick enough. Right up here. His whole pelvis should lift up. I am testing his right side right here. Okay, so knowing that I'm testing his right side in this picture, I'm going to switch colors here. I'm testing his right side. And if his glutes, if he's holding strong with his glutes, then his whole pelvis should come up as well. So the whole pelvis should come up together. And because this left hip is dropped just a little bit, you wouldn't give him a 5 on the right side. You would give him a 4 out of 5, okay, according to the reference. Now, once he comes back down, that's a stronger side. So he's getting a 4 out of 5 the second time because he finally gets the way. But generally, when I challenge him, I can get more motor unit recruitment. So now watch his left side. When I come back over here, I lift up. I'm just checking his hamstrings length, just kind of checking there. Now, where I end up starting is a little bit when we go like into loading response, initial contact, hip flexion with the knee straight. Now, one thing that people commonly say is, well, hamstrings are activated too. And I'm like, I'm okay with that. We're talking about people who have multiple issues going on. And I need glutes. I need to understand how their glute activation is occurring. That I understand there's other muscles working here too. But in acute care, I could just do this like just a little baby, even just lift it up just a little bit, just to kind of see, can I get them to activate glutes and resist? Now I want you to watch. This time when his glutes turn on, they turn on quicker. He has stronger activation. He sustains it longer, but he still is not strong enough to get that whole pelvis to lift up. So this would be a 2. If the pelvis comes up evenly, then they score that as a 5. If it comes up, but this side drops, then this is the side you're testing. This is the side you're holding up. So that's the 4, right? Once you're able to really get a good contraction and get a little bit of lift, but you can't get it up off the plinth, then you're looking at a 3. And then if you're just getting activation, you're getting a 2. Again, it's rough, but I want you to think about how are you testing glute max activation in general with our patients with neurological deficits, because commonly a lot of them can't get prone and they don't have the range, you can't get all these other pieces. I just want eyes on glutes because they are so important. That's what I'm looking for. Now here's just another video just on a student, just to kind of show you. I'm lifting up the leg. I'm not going to lift it that high because of the mat, the plinth, how high the plinth is, but I'm asking her the pelvis goes together. It just goes together. So they're not pushing down with the opposite leg. The leg I am testing is the one I am lifting, and I'm looking to see if that pelvis goes up together, because I know the priority importance of glutes. And I'm going to do this rather quickly. And then I can have them work on at least glute squeezes on their own, or trying to do little bridges with their legs extended on their own. But some of these pieces to try to get some kind of objective assessment, the best that we can, I think can really, what it does for me, let me speak for myself. What it does for me is it keeps my eye on the ball of the importance of glutes and trying to get that activation. So I hope you find that a little longer explanation helpful.